Over the past 2 decades, the beef industry has standardized injection techniques and methods, which today are now widely known as just the right thing to do. These best practices are recommended to help farmers produce safe beef for consumers and maintain Canada's high reputation for beef quality. Properly restraining cattle during treatment is crucial to avoid tissue trauma, incorrect injection technique, and needle breaks. Use a chute that allows easy access to the neck and prevents unnecessary movement in the animal being treated. Incorrect routes of administration can lead to underdosing, affecting animal welfare, production, and antibiotic stewardship. It can also leave cattle vulnerable to the disease being treated or prevented. The route of administration also impacts the ability to eliminate the product, affecting withdrawal recommendations and potentially leading to drug residues being detected in meat. Subcutaneous injections, or sub-Q, are placed just under the skin. They are generally less irritating and are the preferred route of administration, but always be sure to follow the recommendations on the drug label. There are 2 methods to deliver a subcutaneous injection. The one-handed method is accomplished by inserting a shorter needle into the hide at a 45-degree angle, then pushing the hide out with the needle to create a pocket in the subcutaneous space, allowing for injection. The two-handed method is accomplished by first creating a pocket with your free hand by grasping the hide and tenting it upwards and inserting the needle into that pocket you have created. Intramuscular injections deliver the medication directly into the muscle of the animal. This is best accomplished with a longer needle that is placed at a 90-degree angle or perpendicular to the animal. Choose the right needle size for minimal tissue disruption. Always choose the smallest gauge needle that can still effectively deliver the type of medication needed. Disposable needles with an aluminum hub rather than plastic are preferred. Inject beef animals only in the recommended safe zone on the neck, not in the rump or loin. This ensures that if a lesion develops due to the product, it can be easily trimmed away from the less valuable chuck rather than damaging the more valuable round cuts. Injecting outside the safe neck zone can injure the animal. Damage to the nuchal ligament can result in severe permanent paralysis, with a similar outcome if the spinal cord is inadvertently hit. The jugular furrow houses vital blood vessels. Injecting medications directly into them can lead to severe drug reactions. A hand width of space between medication injections ensures adequate tissue recovery and prevents medication mixing. If medications mix within the animal, they can cause reactions or reduce the efficacy of the drugs. The recommended maximum volume per injection site is 10 milliliters or 10 cc's. Increasing this amount hinders medication absorption and excretion. Increased volume may leave unabsorbed medication in the tissue, reducing treatment efficacy and potentially leaving detected drug residue in the carcass. A lower volume injection ensures effective tissue recovery, decreasing the likelihood of an injection site lesion in the animal. Keep equipment clean and in good working order to prevent unnecessary tissue trauma and the possibility of localized abscesses. Never inject through a dirty hide, which will only drag bacteria and debris into the tissue and create a perfect environment for abscesses. Using burred, bent, or dull needles increases the risk of damage and abscessing. Prevent this by using quality disposable needles, changing them when damaged, after 10 to 15 injections, and each time that you use a multi-dose vial.